Hey there, YouTube. I'm a second year medical student, if you didn't know, and I'm going to talk to you about healthcare reform. I'm responding to Joe Biden's video on healthcare reform and his request that we talk about it. So, my medical school is tied to a county hospital, and in this county hospital, I was in the emergency room and I saw this guy with a tumor on his foot. This is one of the first clinical experiences I've ever had, and it was on his foot, and it was the size of his foot. So his right foot was twice as big as his left foot because there was a huge tumor on it. And I asked him, "Why did you come in sooner?" He goes, "Well, it did start about the size of a pimple. I wasn't sure, and it kept growing and growing, and I didn't have any health insurance, and I didn't have a doctor to see, so, I didn't have anything to do. My friends brought me to the emergency room because I can't walk, and my life is horrible, and, I'm kind of scared about the bill that's going to be coming." So if you didn't know, emergency rooms treat before they bill. So regardless of whether or not you can pay, emergency room will treat you. They'll send you a bill, and if you don't pay the bill, your credit goes down the tubes. But, so what? You already got your treatment. So right now, the state's going to pick up the bill on this guy that has no money. They're going to pick up the bill, the thousands of dollars of bill that's going to cost to amputate his foot, when we could have paid $50 to $100 or whatever for him to see a primary care doctor. So he could have just cut the tumor out to begin with. This wasn't metastatic tumor, it's just a huge benign tumor. I'm saying this in response to what I keep on hearing Republicans say it all the time. The only way to cut costs is to cut treatments, when that's entirely not true. They say the only way to cut costs is to treat you less. The other way to cut costs is to treat you more. Whoa, that's a little counterintuitive. But if we treat more on the front end, with colonoscopies, mammograms, cutting out baby tumors, we can save so much more. So we can save so much money by avoiding these other huge healthcare costs. That's why Britain spends less than half that we do on healthcare and has a greater life expectancy. They spend $2,500 per person per year. We spend $6,000 per person per year because we're treating really chronic illnesses, really advanced illnesses, when we could have been getting them on the front end. That's what Obama says all the time: get things on the front end. He wants to treat more. Well, how are you going to treat more? How are we going to get the 50 million people without health insurance? And that's where the public mandate comes in. You have to require all small businesses to provide health insurance to people. Okay? And the only way you can do that in a feasible manner, health insurance, small companies are suffering enough as it is. How are they going to afford to give health insurance to people? Well, that's where the public option comes in. The public option is necessary because their aim is not to make profits. It's going to be as cheap as actually possible. Health insurance companies right now that are private have to pay their shareholders, they have to pay their CEOs, they have to pay for advertisement, overhead administration. There's so many costs that a health insurance private has to pay that a public option doesn't have to pay at all. That's why it's going to be cheaper. We need this to create competition so that the costs get lowered, so that when we lower the costs, public mandate would actually work. So we need a public mandate that everyone has health insurance so we can catch things on the front end before we end up paying for it when they're horrible advanced diseases, which we will do because emergency rooms have to. And you will pick up the bill as a taxpayer if they can't pay for it. And we also need a public option to make this mandate even feasible, so that the cost can be as low as possible, so that it's the smallest economic burden as possible. But here's also that we have to invest in. If everyone has health insurance and can see a doctor, is there going to be a doctor for them to see? We need to build more medical schools. We have to expand the size of these medical schools. And we need to expand the amount. We need incentives for primary care physicians. We need to draw medical students and draw them to primary care. The smartest kids in my school, basically right now, aren't going to this specialty that requires you to be smart. It doesn't require you to be that intellectually advanced. They're going to the specialties that are hardest to get into. Of course, the hardest ones to get into are the ones that pay the most. Dermatology. It's my favorite of mine that people love to go to. It's not too hard, but you get $500,000 a year, so, it's going to be hard to get into. It's going to be fairly competitive. So we need to focus on getting more doctors into primary care, because if 50 million people get insurance and want to see a doctor, there's probably not going to be a doctor for them to see right now. So we need to do this at the same time. Some options, paying for cognition, it's this term, never mind. Some options that we can do is up the pay scale of primary care doctors so they could draw more people to it. A better way, I think, would be loan forgiveness. There's some loan forgivenesses in primary care, but they're not extensive, and they're not necessarily doing the job because people aren't going it. I have a $250,000 debt that I'm accruing, and I need to pay it off. That might require me to go into a specialty so that I can pay it off and still have a nice quality of life. So we need a public mandate. In summary, we need a public mandate. We need a public option to make this public mandate even feasible. And third, we need to invest in primary care for doctors. That's summary. That's going to be, a lot of that is included in the healthcare reform that Obama is proposing, so I am full support of it. I hope this helps dispel some myths about the healthcare reform. Okay, thanks.